My case study is on tobacco addiction. So, step one, background. Tobacco addiction became a major problem in public health around the 20th century when cigarette advising normalized smoking, linking to status, masculinity, and social status. This issue grew quickly in the US and Europe before any health risks were fully understood. And today, tobacco still remains one of the number one leading causes of death, and it is very preventable. Over 46 million adults in the US still smoke. There are a lot of youth that are still vulnerable and try cigarettes every day. Smoking rates are highest in the American Indian and Alaska Native populations and strongly linked to mental health disorders. Historically, men smoked more than women, but the gap has narrowed, increasing health risks across both genders. So, step two. Today, tobacco creates enormous healthcare costs and productivity loss. Even with all the strong public awareness campaigns and everything, there is still a lot of addiction and it is quite difficult to reverse. Youth exposure still continues, especially through vaping. Um, the SWOT, public awareness, is a strength, but relapse is also a major major weakness because nicotine is biologically addictive. There is opportunity in strengthening youth focused policy, but the biggest threat is the continued influence of tobacco and nicotine industries adapting their marketing strategies. Decision makers had to balance economic power, cultural acceptance, and public health risks when designing these solutions. So, for root cause, the root cause of tobacco addiction is the nicotine dependency reinforced by systems that made tobacco accessible and socially acceptable. Tobacco companies historically targeted youth and vulnerable populations in order to create lifelong customers. Addiction is tied to stress and poverty and mental health challenges as well, with higher smoking rates among people with psychiatric conditions. They show addiction in deeply connected to social and psychological environments. So, for step four, two possible solutions stand out. First, a more stricter youth focused policy, such as advertising restrictions, taxations, school based education. The second thing is integrating tobacco addiction treatment into mental health services. The social ecological model helps explains this approach. Addiction occurs at multiple levels: individual behavior, peer influence, community environment, and policy systems. Effective solutions must target all these layers instead of focusing on one personal choice. And then next, I have recommendation. So, based on the analysis, my two recommendations are expanding prevention education before addiction begins and integrating addiction care with mental health treatment. Through this, prevention reduces long term healthcare burden, and treating addiction as a health condition increases recovery success. So, the action plan focuses on implementing a school based prevention program. Months 1 to 3 would involve a curriculum development, and then 4 to 6 would be a teacher training, and then the last period, 7 through 12, would involve full implementation and evaluation. Um, Also, public health departments and educators share the responsibility, and I feel like this timeline allows structured rollout while measuring effectiveness as well. So, conclusion. In Australia, they reduced smoking through plain packaging laws and advertising bans. This is a great international example that shows policy level intervention and can change behavior at a population scale. My conclusion is that tobacco addiction proves that public health problems are systemic. Prevention, policy, and social support must work together, and addiction cannot be solved by any personal responsibility, and it requires structural change. And these are my references.